So the first thing to understand about arthritis is a progressive and cyclical disease. So you might have a really good day, but then you might have a bad day the next day. And when you're having a good day, you don't need to have any treatment at all. When you're having your bad day, you might take your anti-inflammatory or your Panadol or use an ice pack or limit your activities. So typically arthritis pain is localized in the knee itself. You're not going to get the pain in the calf or the thigh or the back, but within the knee itself. And it's typically not so much rest pain, but activity pain. So if you sit for half an hour and you get up and start walking, you might find that you hobble for 2 or 3 steps, but then your knee warms up. And while you're walking, you don't seem to have too much pain, and you might have a very busy day, but then you get home that night and then you might get some aching in the knee that night as a leftover from that busy day. And when you do that, you'll try simple things. Panadol is very safe. So you might try a couple of Panadol, you might put an ice pack on the knee, and if your stomach can handle it, you might try some anti-inflammatory tablets. And when the simple stuff stops working, that's when you might think of either seeing a physiotherapist to get some exercises to strengthen up the muscles around there, because if the muscles are bigger without irritating the knee, then the shock can go up through the muscles and take some of the shock away from the exposed bone in the knee. So that brings us back, I guess, a little bit to what is arthritis. And the simplest way to think about arthritis is damage to the joint lining of the knee. So instead of having shock absorbers and nice shiny cartilage, you've now got rough exposed bone. And when you walk, the 2 bone ends bang together, and so the exposed bone is where you feel that pain. Now, it doesn't really matter how crooked your leg is or what the x-rays look like. The treatment for all of this is determined by your pain. So you might have a terrible looking x-ray but very little pain. That's not going to get you a knee replacement. Okay, you really have to have enough pain to justify the knee replacement. So what might that be? You might only be able to walk 5 or 10 minutes due to your pain. You might need a handrail to get yourself up and down the stairs. The pain might be waking you up at nighttime despite having taken some painkillers. Those are the sort of triggers that you're thinking about, okay, look, this is really interfering with my lifestyle. I now need to have surgery. But before you get to surgery, you're going to have spoken to me, and I will have talked to you about lifestyle modifications, using a walking stick, perhaps changing to nice shock absorptive shoes, occasionally a corticosteroid injection or something like a hyaluronic acid injection. And in younger patients, there are other alternatives as well, such as braces or even temporizing surgery to get you through before you get to that knee replacement stage. So ultimately what it comes down to is this: it depends very much on your symptoms, and when your symptoms start to get worse, start off with your general practitioner who's going to examine you, get an x-ray organized if that's appropriate, and start the simple medications to see how long you can stay away from the surgeon.